Hello everyone, welcome back to the channel. Today we'll be discussing about Cubital Tunnel Syndrome, which is also known as ulnar nerve entrapment. This is the compression of the ulnar nerve that is located right behind our elbow. You all must have heard about the funny bone where you hit your elbow to the edge of a table and then you feel a shock-like sensation running above. Funny story, that isn't a bone, it is actually the entrapment of a nerve. So, this nerve controls a few muscles in your forearm and your hand, specifically the little finger and the ring finger. So, when compressed, it can cause pain, weakness, and even numbness to that particular region of the body. अभी आपको कैसे पता चलेगा कि आपको ये वाला condition है कि नहीं? Here are 5 signs. 1. Tingling sensation and loss of sensation in these two fingers, which is the little finger and the ring finger. Number 2, you will have clumsiness in the grip, which means you might lose your grip strength. Number 3, you will have prolonged pain in the inner aspect of your elbow, especially when you hit something, as we said about the funny bone. Number 4, your symptoms might aggravate during the night time when you hold your phone and sleep, news, and text people. So now let's talk about the common causes for these conditions. 1. Repetitive elbow bending movements. So this you can see in people who play badminton or weightlifting. They tend to flex their elbows a lot. Number 2, prolonged elbow flexion movement or elbow bending movement. You can see it in people who use their phone a lot or on call the whole time. They have their elbows bent the whole time. Number 3, direct blow or direct hit to the elbow. Number 4, post-surgical scarring. So let's talk about the confirmatory tests or the diagnostic test for this condition. One is the Tinel sign, which is the repetitive tapping over the cubital region, which is the elbow, anterior aspect of the elbow region. So repetitive tapping would elicit shock-like pain and you wouldn't be able to control. Number 2, we have the provocation stress test, which is the medial aspect of the elbow needs to be pressed, which is where the ulnar nerve runs over. So a firm press over this region would elicit pain. There are two more tests that you can use non-physically, which is the nerve conduction study, or you can use a MRI or an ultrasound to confirm chronic cases. Some of the managements that we can do conservatively are as follows. You can use splinting, which is keeping the elbow in an slightly extended position when you sleep at night to relieve pressure. You'll feel better while splinting it in an extended position just for the night. So here are some conservative managements for this particular condition. We have activity modification where you can switch to earphones or headphones instead of keeping your hand in this flexed position. Number 2, we have strengthening. Number 3, we have physiotherapy, which gives you a world of good and helps you relieve the pressure or the pain with multiple sessions or sittings. Number 4, we have chiastium, which is an instrument assisted soft tissue mobilization. And last, we have splinting, in which you can keep your elbow in a slightly extended position where it will relieve your pressure or the pain, especially during the night times, not to splint during the day. So here are some tips that you can do at home to relieve the pain and make you feel much better. One, you can wrap yourself with a towel around the elbow region at night if you can't buy a splint. This is a helpful tool that will help you relieve the pain at night so that it doesn't let you bend your elbows. Now we have nerve flossing. In this, you'll have to hold your hand in this position, which is almost similar to a waiter holding your meal. And then you need to extend your elbow and your fingers together. So this is a flossing movement which will help you relieve pain. Next, we have the wrist flexor self stretch, where you put your arms in the front and then pull your fingers back. You can keep this position in hold for 10 seconds for up to 3 sets. Next, you can get yourself a towel wrapped in this position with your thumbs facing up and start squeezing, which helps you isometrically with grip strength. You can also use a soft ball. Next, we have the finger exercises where you can also use a rubber band and abduct your fingers as so. You can repeat this exercise 10 times for over 3 sets. Next, we have elbow isometric exercises where you can slowly press your elbow against the wall over a towel and hold this position for 10 seconds for over 3 sets. Next, we have the ulnar deviation exercises where you can hold your palm in this position with thumbs facing up and then slowly ulnar deviate as so 10 times for over 3 sets. Next, we have shoulder blade squeezes where you put your arms to the sides like this and then squeeze your shoulder blades, hold for 10 seconds for over 3 sets. We have one more simple exercise which is holding your palms against each other in a prayer position and then slowly push downwards. Hold for 10 seconds for over 3 sets. So do follow these exercises if you have the condition and let us know how you feel in the comment section below. Do like, share and subscribe to this channel. And finally, witness your fitness.